we've worked out that actually every risk factor of cardiovascular disease is a risk factor of cerebrovascular disease and therefore of the integrity of the IPAD process. So the drainage, the IPAD process, depends on the integrity of the smooth muscle cells and the functionality of the smooth muscle cells and also of the basement membranes. With aging, there is arteriolosclerosis that decreases the function of the smooth muscle cells and changes the composition of the basement membranes. But aging is not the only factor. Possession of apolipoprotein E4 genotype results in composition of the basement membranes that is very similar to aging. So actually, what we have demonstrated through our preclinical work is that in the presence of APOE4, there is actually a process of premature aging of the IPAD pathways. The other risk factor is, of course, hypertension. Now, we know that hypertension is related to dilated perivascular spaces and white matter abnormalities in certain areas of the brain, basal ganglia especially. But hypertension affects the wall of the blood vessels everywhere in the brain. And what we have demonstrated through collaborative work with neurologists in Magdeburg, specifically Steffi Schreiber's group, is that hypertension alone will interfere with IPAD and will result in buildup of amyloid beta in the walls of the blood vessels. The other important factor is hyperlipidemia. And we've shown that in postmortem brains that have been diagnosed with hyperlipidemia or dyslipidemia, there is more cerebral amyloid angiopathy compared to brains with normal lipidemia. And also, one of the strengths in my institution is the hypothesis, it's called the Barker hypothesis, the hypothesis that a mother's diet during pregnancy and lactation will drive the potential for the baby to develop metabolic disease during adult life. So we have a very good system of preclinical and clinical work. We also have an experimental mouse colony. So what we did was we analyzed the pups born from mothers fed a high-fat diet. Of course, it's not ethical to do that in humans. So we analyzed the brains of those pups and how the pups themselves were fed a normal diet, and yet they showed a deficiency in clearing amyloid beta, both at a younger age, and that deficiency was emphasized with age. So that sends a very important public health message, we think, and we're continuing to work on that aspect.